And today's video, I would like to issue a challenge to Angry Prepper. And that challenge is, I've seen several of his videos where he has made some basically condescending remarks on people that think the virus is fake. And so therefore he's pretty much put it out there that he believes this is a real virus. And seeing as that is the case, that he thinks it's a real virus, I would like to challenge Angry Prepper to actually doing some research on that. And if you need some help, I can send you some links and some videos.
Let the science and let the evidence guide you. Always stick with the science. Stay away from politics. Public health and global health is what I've devoted my entire professional career to, with a very strong science base, because I'm a scientist. So I'd hope to be remembered for someone who stuck with the science and made contributions through multiple outbreaks, from HIV up to the most recent now with COVID.
Well, Huples Cat. Been a while since I did a COVID pandemic update, but I thought, you know what, let's do one. Been taking a bit of a break from it. We are surging in Toronto, and I will show you that now. I just want to talk about the introduction to this. There is still a large number of people out there who are actively trying to kill a large number of people because they do not believe the pandemic is real. They do not believe it's real, or if they believe it's real, they believe it's no worse than the flu. And it's staggering that they're still out there and people are still watching them. It's crazy. These people need to be put in little boxes marked ignore completely. They are a clear and present danger to public health and your health. As you can see from this, we've had a bit of an upswing. To give you some context, we have about 92 to 96 ICU beds for adults in my place of work. Bearing in mind, most of those beds are not ventilatory beds. They're kind of higher observation beds, and a large number of them are for specialist services like cardiovascular, cardiac surgery. So the impact is quite dramatic in terms of functioning. We did have a remarkably quiet weekend for trauma, which is why I was able to leave Monday morning with a few beds still able to be used. But as the days progressed, they've started to do a few things. We have 2 ICUs that are entirely COVID. The COVID floor is going to be entirely COVID. Yes, we mix and match patients. And we are also increasing the ventilatory capacity of the ICU without regard to nursing staffing. So as we get more and more cases, the nurses have to be stretched more and more and more. So a lot of people are saying about the nursing homes. Last time around, we got no nursing home patients at all for months sent to our hospital for almost any reason, which is fascinating. So it was localized in the nursing homes because that's the age group that's most dramatically affected by illness and death, and it didn't really impact the hospital dramatically. They then spent 2 months basically empty with nobody in the community, and then decided to fill up with surgery because they'd made such a backlog by bad planning. And then, of course, now we're getting the second wave, a second surge, and what we're seeing is that the hospital's full up with surgical cases, and they're still trying to continue to do surgical cases at the same time we surge with COVID. So it's going to be an interesting week. I'm off till Wednesday, Thursday night. I'm hoping this has been resolved in terms of how we're dealing with this by Wednesday. It's going to be an interesting week. Of course, Canada is not alone. This is a global phenomenon. Pretty much everywhere is seeing a huge dramatic rise in cases. This one is from England. You can have a look at it, see what it means to you. If you live in England, it means that you're more likely to, in the community, encounter people who are positive for COVID. You are more likely to catch COVID if there's more community incidents, and having caught it, you're less likely to get really good care in a hospital, especially if you live in an area with a large number of COVID patients entering the hospital. I mentioned before Australia. Australia is finishing its winter season right now, and they've had almost no flu. They've had phenomenal success in not having flu around because people are wearing masks, distancing, washing hands, etc., etc. As you can see from this data from England, as flu season starts for us in the Northern Hemisphere, we're seeing the same phenomenon. And yet I'm still repeatedly hearing people on TV who are doctors and government officials saying, combined with a massive flu outbreak that we normally get, seasonal flu we normally get, the hospitals won't be able to cope. That would be true. There really probably is almost going to be 0 flu outbreaks this year anywhere that actually does decent public health safety. There will be some, but very few compared to what we normally would expect, because the population largely is protecting itself from transmission of flu. But the actual incidence of COVID is so much greater than the normal incidence of flu, we are going to be overwhelmed in healthcare. It's not a question of if, it's a question of when and how do we deal with it. And I'm not really hearing or seeing much thought being put into that. So they have had quite a bit of a spike about rhinoviruses, and they're dropping off, and that's actually typical with children. Again, I do not believe children should be in school, nor do I believe adults should be in university or college during a pandemic. I believe they should have took the entire year off from September to September next year. I do believe this is going to be that serious. Time will tell. I don't believe school is essential. Parents should be teaching their kids at home, and if all the children have effectively a gap year, none of them are actually put at a disadvantage. So this slide again from England shows you quite clearly where the ARIs are coming from. Basically it's all of them, but most of it's COVID, and you can see where it's coming from. And if you're trying to actually mitigate to prevent the spread of an airborne disease like COVID-19, you want to target the areas that are actually having the biggest amount of cases. And as you can see from this, what most of our governments are doing is they're not really targeting the areas that are actually the biggest generators of transmission. Now, I'm not going to go out to a bar and a restaurant, and they've actually been closed down around me because of a spike in cases. But in terms of generating infections, as you can see, insufficiently staffed, not quarantined properly nursing homes are by far the biggest incidents of this. Quite closely followed, if you look at this, by other things, and the other things are whatever, I guess. But if you actually look at what the blue is, workplace. And what after workplace? Well, in England, it's hospitals and prisons. In fact, if you look at food outlets, they're supposed to be very bad. Food outlets are a tiny generator of spread. So if you actually want to prevent spread, you will close down as many workplaces as possible. You will seal off the nursing homes as tightly as you can. Sorry relatives, you infect them. But if care home workers are underpaid and working multiple jobs and live in high incident communities, that won't really work. You need to come up with a more creative plan. Bubbles in effect for nursing home workers, so they're not actually infecting the entire facility and their co-workers. There's lots of things that could be done creatively that would impact the economy. The economy is going to be damaged. That's a separate incident altogether. By this time next year, the economy is all anybody's going to be talking about. And this is just that chart broken down into actual text and numbers. As you can see clearly where you need to focus your efforts. And the efforts need to be focused quite clearly on where the biggest transmissions are. And those biggest transmissions are the very areas the governments are trying to keep open. Normal workplaces, normal schools. That's a big mistake. The United Kingdom, like everywhere else, and you can see from this graph, is actually experiencing a massive rise in all age groups, specifically the age groups that didn't really have much incidence last time. The reason that they opened the schools, because they reckon they were damaging all the children by having all the children off school, was that children and young adults aren't really susceptible to the virus or the transmission of the virus. Of course, now they've opened the schools, quite clearly all human beings are actually able to catch this virus and to pass it along. What is true and remains true is that once you get to the 60 plus age group, you're much more likely to be hospitalized and die. However, the group under that is also at risk from hospitalization and death. And I just back of the cigarette pack figures here for you guys. If we didn't bother doing anything in Ontario based upon the current death rates in my province, we'd be looking at between 5,000 and 10,000 people dying over the next year under the age of 50 who were previously fit and well. Now, the death toll in the older age group would be in the hundreds of thousands. So that is why the governments are doing what they're doing. That is why they're trying to lock down and trying to deal with this. This is why they're trying to encourage people to wear masks and wash hands. And as time goes on, you will find it's going to be more and more autocratic and controlled to do that. Because this is as big an event in our lifetime as World War II was in our grandparents'. And I don't really care how many videos and links you've got to prove me wrong, because you are crazy. I'm just going to show a video from Dr. Fauci from the States where he talks about some of these issues. Sit back and listen.
What I've seen is something unprecedented. Throughout outbreaks, you always have disagreements about how things should be done, but we've never seen the polarization, which is the reason why, as you say, there are many people who are very much encouraging of what I'm doing in the arena of science, and some people that push back sometimes with the extremes that you mentioned, actually with threats. If you just sit back and think about that for a while, how little sense that makes, that someone who disagrees with what you're saying from a public health standpoint actually takes that to the extreme of suggesting violence. We've never had anything like that, at least in the years that I've been involved. And what has happened is that when you're involved in a divisive society that becomes very politicized, all of that subliminal and sometimes not so subliminal anti-science feeling becomes intensified. And I think you captured it very well, because it isn't just an anti-science feeling, it's almost an aggressive push against science.
If you're disliking based upon politics, you are crazy. Pandemics do not care if you are left, right or centre. Bear in mind, Dr. Fauci has worked for 6 presidents. I would say probably 5, because I don't think Donald Trump's used him at all. And Dr. Fauci is very respected internationally as what he does. He's getting a bit old. I hope he gets a nice retirement soon. I'm glad that he didn't die from COVID-19. I think very sad that people in these positions actually were so at risk because of politics that they actually got infected early on. And you're still seeing in the American government quite a lot of infections in senior people. This is not a great thing to do when you're in government. You need to actually isolate and protect the government. In my role, in the old pandemic plan that was done by the Liberal government in Ontario, because healthcare is provincial in Canada, not federal, I was actually instructed because of my role to lock in my office and never go out of my office. Under the new, very kind of woolly, ethics-based, millennial type plan we have, they haven't put that restriction in. So critical workers in critical areas are actually being put at risk from catching the virus and possibly being hospitalized or dying, or at worst being off, or 20% of them having a brain fog, by policies that don't value the workers in critical positions. And we've seen this with grocery store workers. Absolute farce that grocery store workers got a little bit of a boost of pay in Ontario and then they removed it. They need a bigger pay for what they're doing. They're really, really at risk. And of course it's not just politicians and civil servants and healthcare workers who are at risk from this. People that associate with people who are having massive contacts with other people are at risk of this. And as you can see, even if you're a billionaire and you believed yourself to be above and safe from COVID-19, you can catch this. And it'll be interesting to see, because obviously money will not be spared in treatment of these types of people, but however much money we spend on this per patient, a sizable number of patients don't respond to anything and they will die. So I'm hoping these people don't die, but I do think that if you are in that minority of people that believes that it's not real, it's no worse than flu, the risk of death is almost zero because you can have hydroxy or bleach or whatever the nonsense of being spouted out there is, you're wrong. It's killing a minor number of people that catch it, about 2 to 3% to 4%. That's significant. That's a huge risk of death. If it's 4%, 1 in 25 people that catch it die. If it's 1%, 1 in 100 people catch it and die. It looks pretty much from the world figures, it's 2.5% that catch it and die. And die. A lot more people are going through ICU to stop them dying. If ICU is not available, they will die. So a lot of these people that have been pushing quacks and lies are actually now starting to find that the focus of the law and the disciplinary situation is now focusing on them. I suspect this French doctor won't be the first person to feel the cold breath of responsibility for their inactions and falsehoods. It's going to be interesting what's going to happen over time. We're going to look for scapegoats, we always do. Trump's going to be left from office, so he's an obvious scapegoat for the Americans. But in terms of individual terms, people are going to look for blame victims. And it doesn't matter how powerful you are, you're going to become a blame victim if you are in an opposite position to reality. And a lot of people have been in opposite positions to reality and still are, in my opinion. I still find a lot of the infection prevention control team are actually still clicking their heels together and refusing to look at What do we do if we go from 16 patients in our hospital to 150 over a 3-day period of the weekend? Nobody's doing that kind of disaster planning. Not saying that's going to happen, but if that does happen, I would like people to have thought about what we're going to do before it happens, not just as it happens. Now, Sweden has falsely been put up for a lot of things. Sweden is a very, very socialist country, but a lot of the Americans are actually pointing to Sweden as don't lock down, herd immunity. So I just want to point out that Sweden's seeing a rise in cases. Sweden is now actually bringing in lockdown measures because their death and disability rates have been so much higher than their neighbouring countries, and it's got to the point now where their healthcare system is collapsing. So Sweden is finally catching up with what everybody else was doing. Now, much was made last week of the cruise liners looking for volunteers to go on cruises to test out their COVID protections. What was not made clear to people was that the first actual public cruise, which was mostly filled with Americans, because a lot of American media, not just fringe media like I showed at the beginning of this, but a lot of American media is actually anti-science and is not actually reality based, booked a cruise, went on a cruise in the Caribbean, and now some of them have COVID, so it had to come back to port. Again, I'm going to do some more videos on this. I'm kind of been resisting doing COVID videos because frankly I'm kind of very sick of it. I'm also very worried about it at work, and it's been affecting our decision making as people, me and Kitty, but I'm going to do a video on that. But just to give you a bit of teaser for that, there is some good news. I don't think this will happen, but maybe COVID-19 will actually make people sit up and think about where their meat comes from, how their meat's treated, where their fur comes from, and why they're wearing fur when they don't live in the deep Arctic. So there may be some good things coming out of this, but in the here and now and for the foreseeable future, this pandemic is nothing but bad news. And it's going to be catastrophic as far as I'm concerned, both in terms of effect on human health, but also, and I think this is going to be much more important, in terms of the economy. And I absolutely believe, because of the research that's been done so far in this pandemic and the research that's been done in previous pandemics, that a failure to deal with the pandemic aggressively by governments and healthcare actually causes a worse economic outcome. But even so, I think we are looking at a situation coming up in 2021 where the economy suffers a reversal as bad, and I believe as worse than, the reversal that happened in 1929. I believe that's actually already happening. It takes 6 months to a year for people to figure it out. And I'm going to talk about some people I know who've lost their homes and lost their cars in good old socialist Canada because they weren't paying tax. They were doing jobs like dog walking and gardening. And they weren't paying tax. They were making a fairly good living. But they couldn't claim EI and they couldn't claim CERB because they had no actual income to prove it. Anyway, take it easy. If you've got any questions, let me know. I'm going to do a few more serious videos over the next few weeks about COVID. I really want to talk about how you actually are going to safely prep yourselves and deal your lives dealing with the second wave. The second wave is clearly starting. I'm going to show that. And if you look at the global phenomena, we are at the beginning of the second wave. Not in the middle of it, not at the end of it, not at the peak of it. We're at the beginning of the second wave. This second wave is probably going to go on for another 3 to 6 weeks. It's going to be bad. It's starting much higher than the first wave. Anyway, remember to give me a sub if you like this sort of content, or if you just feel like watching me because I'm sexy. Give me a thumbs up if you want, give me a thumbs down if you want, because COVID doesn't exist, and unfortunately we don't see the list of names, so we can't name and shame. Those creators out there who are still putting doubt on people wearing masks in public spaces, can you please stop it? You're not doing anybody a favour by taking an adverse position just for clicks. It's not a smart move. I know you've seen videos, I know you've read blogs. There is no evidence whatsoever that masks are dangerous, nor that masks are not necessary. They're critical. What is more critical is distancing, hand washing, not hanging out with people, indoors or out. Okay? Toodles.